And good morning. This is Adam Collins, the Planning Section Chief for the EOC. Today, it's the Anchorage Emergency Operations Center operational update. Today is June 2nd. As a reminder, we're continuing with the Sleeves Up for summer. This is Max, who is visiting our vaccine centers. Situation, go ahead.
Good morning. Today is day 455 of our response. As currently reported, statewide, we're at 255 cases in the last week with no new deaths and 7 new hospitalizations. And locally, up 67 cases with no new deaths or hospitalizations. Next slide, please. 213 resource requests, we filled or otherwise satisfied 1,755. with 25 currently working. That's a typo on this slide. It should be 25, not 26. My apologies. Next slide. In the congregate sheltering sites, we've got 380 clients. That's down 10 since the last report a week ago. In the non-congregate sites, 339 clients, up 7. That's 719 clients in all shelters, down 3, averaging 2,157 meals served per day. Next slide. In the last week, at the visit testing sites, there were 2,015 sample collections performed. And in the last week, at all pods, there were 1,300 doses administered, with 73,400 cumulatively to date. End report.
Thank you. Situation. Weather.
Yeah, good afternoon or good morning, everyone. This is Michael Cutts, the National Weather Service office at Sand Lake. Today is going to be our last day for the sunshine. We're going to see a mix of sun and cloud through the remainder of the week. Most of our chances for rain tomorrow, and a warming trend through the end of the week. And other than that, some breezy conditions and along Turnagain Arm all the way up to Fire Island for Thursday. That concludes my briefing. Are there any questions?
Thank you, Weather. Testings, vaccination.
Good morning, everybody. This is Pat Ryder, the Emerging Infectious Diseases Assistant Program Manager. Today with testing, Visit Healthcare had an increase of 29.33% over previous Tuesday sample collections. As of June 1st, our estimated daily growth rate is actually a drop of 4.42%. Our 14-day average reproductive rate is 0.785. That number is trending downward and staying below 1, which is good. And our 14-day average case rate is 3.68 for every 100,000 people in the population. Our current alert level is low. We're currently working on contract extensions for Visit Healthcare. Elmore testing will be closing on June 5th due to low testing numbers. And we're currently reaching out to summer, day, and overnight camps to discuss testing and the available use of testing resources from the state of Alaska. With vaccines, we have some upcoming vaccine clinics this week. Tomorrow we have Cynosure Brewing, Muldoon Boys and Girls Club, and the O'Malley Golf Course. On Friday we have Carte Fields Youth Softball Tournament, the YMCA over at Lake Otis, and the Lusac Library. On Saturday we have the Eagle River Presbyterian Church. Currently working to secure RV and personnel to offer convenient RV-based clinics throughout the summer. Our vaccine group continues to integrate with the Anchorage Health Department on our outreach efforts and summer vaccination strategy. And vaccinations are continuing to be offered for homebound folks. We noticed a decrease in Visit Healthcare clinics of 33%, 33% change in the total vaccinations from the previous week. And a reminder that mobile vaccine clinics can come to you wherever you are, be it a business, church, or other organization. For more information or to schedule, please dial 907-531-5100. Next slide, please. So with regard to the municipality's overall official health risk metrics, our overall risk level is currently at the lower end of considerable risk, and we are trending downwards towards lower risk. With our public health messaging, our main messaging that we want to get out is that we are continuing to observe a decrease in our daily cases, even in the face of our decreased vaccination rates. And finally, additional contributing factors, these include a limited demand for vaccines, even alongside an increase in in vaccine eligibility. And we are also monitoring an increase in the proportion of transmissible variants, along with a decrease in the case counts across the state. This includes testing of vaccines, barring any questions in the report.
All right, thank you. Mass Care, go ahead.
Good morning, this is Sean Hayes, Mass Care Branch Chief. Our Q&I location has 15 projected discharges through the next week, with 5 discharging today. Covenant House Congregate Shelter's last day of operation was May 31st, so it has been decompressed, and we continue to find suitable placements for folks in the Sullivan Arena, as while we expand our non-congregate shelter. End of report.
Thank you, Mass Care. Logistics, go ahead.
Good morning, everyone. This is Scott Carpenter over in the OEM Logistics section. For Mass Care support, our lines of efforts continue. What you've seen in the last couple of weeks remain the same, but just a little bit more information for you. We'll continue on with the summer sheltering contract extensions, and that includes the wraparound services. This is 13 plus contracts that now go through the Title VII procurement process, which is a non-emergency process through purchasing and up through the assembly for approval. These are contracts that are due to expire on June 30th, and we're looking to push the contract extensions out to September 30th. We're also working on lessons learned for future demobilization actions when that time comes. And under testing and vaccination support, we have 1 contract extension that is following under that Title VII procurement process I explained earlier. As far as other support is concerned, we continue to work staffing, both new and extensions for personnel. We continue to work to realign the positions with the incumbents who are actually in those positions and add personnel where necessary. Pending any questions, that's the end of the logistics report.
Thank you, Logistics. Finance, go ahead.
Good morning. This is Audrey Jo Malone reporting for Finance. Current encumbrances are at $18,423,020. Actually spent to date is at $54,020,695 for a total of $72,443,715. Please continue submitting all invoices and some more supporting documentation to EOC invoices at anchorageak.gov. And OEM continues to seek cost recovery by way of FEMA public assistance. Any and all questions should be routed to aaron.zachary@anchorageak.gov. And that is all.
Thank you, Finance. Safety, go ahead.
Good morning. This is Annalisa Roberts reporting out for Safety. So last week, we discussed June being National Safety Month with a different topic every week. So this week, week 1 is identifying risks and taking proactive safety measures to reduce hazard exposure on important topics to include, but not limited to, ergonomics, chemical management, situational awareness, electrical safety, remote work, safe driving, and some stress. So pretty much nobody, when we all went remote, had a professional come out and look at their workplace at home. So there was a lot of sitting on couches, being hunched over dining room tables, and just sitting wherever you could with the new order. So people are going to be coming back to their offices and probably having issues with their setup. So there are a lot of good resources out there for self-assessments, so people can look at their desk or their chair and make modifications on their own to make themselves more comfortable. With chemical management, employers need to have a HAZCOM program to identify the hazardous chemicals in their workplace that employees may be exposed to. So that's a good one. On the bottom, there's a lot of links for different trainings if you're interested. So for situational awareness, it's creating a separate dimension for hazard control. So the U.S. Air Force uses the OODA loop, OODA. So it's observing or seeking hazards or threats, orienting and recalling what hazard controls are available, deciding specifically which hazard controls to use, and acting. So that's a good one for situational awareness. Electrical safety isn't just for the MLMP or Chugach Electric professionals. It's also in the workplace. If people have space heaters going that are on the same circuit as a refrigerator, if they're overloading their power strips with too many things, we've seen them actually burn and catch fire. So we need to be careful of that for others. Remote work. We are still in the process. We've got some people in the office, some people working remotely. So having a checklist and giving employees ideas of what to expect, checking in for their safety meetings or just meetings, just to get an idea of what everybody's working on, and so that they know they're not alone before they come back in. Safe driving, of course, is a big one. When we start coming back to the office, there's going to be a lot more congestion on the roads. So being careful, wearing your seatbelt, staying off your phones if you're driving, and just using appropriate behaviors while operating a vehicle. And then, of course, stress. Stress is continuing to happen. We never got out of that realm. So now it could be stress around the changing COVID rules, a new administration, coming back to the office if people are worried, what to do with their kids if they have to come back to the office. So different stressors out there. So just making sure employees are aware of how they can get help with those stressors and before they lead to complete burnout where they can't function. So that's it for me. See you next week. End report.
Thank you, Safety. Public information, go ahead.
Good morning. This is Public Information Officer Heather Arono. As you saw on an earlier slide, we have been working with the National Crisis Response Dogs to assist at more vaccine clinics. And Max was at the Spenard vaccination clinic yesterday. Very good boy. And we also had a great turnout at the Sleeves Up for Summer Memorial Day car show on Monday. You'll remember us promoting that over the last couple of weeks. Lots of folks turned out to look at some very fancy cars and also turned out to get some vaccinations. You can see some of the Sleeves Up for Summer t-shirts we were handing out if somebody was able to either go over to the vaccination clinic and get their vaccine, or if they had a copy of their vaccination card on hand. So just as a thank you for folks taking that step. We are working on some flyers and other promotions for the upcoming King Street Brewing Company clinic, as well as the Youth State Fast Pitch Softball Tournament at Carty Softball Fields. Continuing our outreach to local businesses about pop-up clinics and to the community at large, just making sure that everybody's being kept in the loop. And we are also keeping a close eye on the federal government's announcement of the month of action in June, trying to hit that 70% mark for vaccinations nationwide by 4th of July. So if you know somebody who's been on the fence about getting a vaccination, now's the time to encourage them to do that. Barring any questions, end of report.
Thank you, Public Information. Liaison Officer.
Good morning. This is Celeste Prescott, Liaison Officer for the Anchorage EOC. I'd like to thank all of our cooperators that were able to join us today. We'll go ahead and start it off with Tracy with Mat-Su-Borough EOC.
Last week's Friday fling had a decent turnout despite the rain, with 18 doses administered. This week, we're supporting the public health nursing clinics at Sioux Valley Junior Senior High School and Wasilla Middle School, and next week we'll return to Friday flings. Thank you.
Thank you very much, Tracy. And now, do we have any other partners that would like to report out? Okay, hearing none, we'll move on to our hospitals. And Kirsten with Alaska Native Medical Center was unable to join us today, but she is reporting out 2 positive COVID patients, 1 in the ICU, none on ventilators, and no PUIs. Was Sean able to join us from Alaska Regional Hospital? All right, looks like Sean wasn't able to join us. What about Nikki or anyone else from Providence Alaska Medical Center?
Good morning, this is Nikki from PAMC. This morning I wasn't able to access our dashboard, it was down, but I do have a couple numbers. So we did have 6 COVID positive in-house and 1 COVID recovered. As of yesterday, we had 0 patients on mechanical ventilation or in the ICU, but I can't tell you what that is today, unfortunately. And that's it. Thank you.
Well, thank you, Nikki. Thanks for giving us the numbers that you had. That's great. And was Kara able to join us from Mat-Su Regional Medical Center?
Good morning. This is Kara Cahill from Mat-Su Regional Medical Center. We currently have 1 COVID patient that is in the ICU and on a ventilator. End of report.
Thank you so much, Kara. It's great to see all those numbers dropping. And was Sergeant Perez or anyone else able to join us from the 673rd Medical Group?
Yes, ma'am. Good morning. This is Sergeant Perez at the 673rd Medical Group. Reporting our vaccine numbers, as of yesterday, we have administered a total of 18,744 vaccines, 10,025 of those being the first dose and 8,719 being both doses. These numbers will be placed in the chat box for your convenience, pending any questions and a report.
Thank you so much, Sergeant. Thanks for joining us. And that's all for liaison.
Thank you, ma'am. Department of Health. Okay, well, that concludes today's operational update briefing. Remember, sleeves up for summer, and everybody have a great day.